Okay, so it looks like we have one more patient for the rest of the evening, but they're about 25 minutes late. Oh my goodness. Okay, so the doctor has a very important meeting after this, and I have a very important meeting with the sandwich, so let's have the front desk send them on in immediately so that I can begin the fastest exam ever. Okay, and oh, hello there. Welcome to Dream City Clinic. I am Nurse Celaine. Pleasure to meet you. Very good. And today we're going to be giving you a very fast nurse exam because you are very late today. Did you know that? Okay, I'm going to ask you first to sit down right in front of me before I ask you all these questions and just square up with me, just shoulder to shoulder. Oh, square up, but I'm going to need you to calm down, put those arms down, okay? Just shoulder to shoulder, very good. And quick question before we begin, why were you so late? Were you playing Fortnite, maybe 11 Deep Space, watching the Olympics? What were you doing? Oh my gosh, you're just so tired you lost track of time. Well, I'm going to make sure that you're healthy and make sure that you're absolutely fine because your health is number one. But I do have to perform this exam very fast because I do have a date with a sandwich. So what I'm going to do very first is ask you first name and last name spelled out, please. That's a beautiful name, by the way. And your birthday. Okay, and then a quick question just to check and gauge your age. Okay, do you know what skibbity toilet is? Okay, and if I say the number is 8675, do you know what numbers come after that? Okay, if you had said 309, I would have thought that you were a little bit older than you really are. Okay, so now we're going to first check your vitals. I'm going to just carefully get your temperature on your forehead. May I place this on your forehead? Good. Just you're going to feel a little bit of that on your forehead. Good temperature. One more time. We got to perform this nurse exam super fast. So perfect temperature. Let's actually get your heartbeat now. And how have you been feeling lately? Have you been sick in the past 2 weeks? Has your vision changed in the past 2 weeks? And what about your hearing? Okay, you've just been really tired. Okay, I'll make sure to double check that. So I'm going to place this right here on your chest. And on the other side, we're just going to hear your heartbeat. Okay, just relax. Good. 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 And the other side. Sorry if this is a bit cold. Good. Great, okay. Looks like your heartbeat is absolutely well. I'm going to check your pulse oximeter now. I'm going to put this right on your finger, okay? And can I just see your hand right there? Thank you, love. And your hand is beautiful. You have gorgeous nails. So I'm just going to carefully put this on your finger and I'm going to do a countdown, okay? You're going to hear a little beep. Okay, give me your hand. Okay, 2, 3, 4, 5, 6, 7, 8. 3, 4, 5, 6, 7, 8. 4, 5, 6, 7, 8. 5, 6, 7, 8. 6, 7, 8. 7, 8. 8. Okay, let's remove that from your hand. And your pulse oxygen level is at 98. Okay. And a quick question, have you felt any really sense of tiredness in the past couple of weeks? When did you start feeling more tired than usual? Okay. And when did your eyes start feeling more tired than usual too? Okay, I'm going to quickly check your blood pressure now. Put this right on your arm, okay? And it's really soft. It actually kind of feels like a pillow. I'm going to slip that right onto your arm. Okay, are you relaxed? Good. I'm just going to get your pulse, your oxygen level, just your blood pressure. Okay, stunning. It actually looks like you have very good blood pressure. Let me remove that from your arm, okay? Good, and are you feeling okay, sweetness? Okay, I'm going to carefully check your eyes now with a pen light. Do you have any light sensitivity? Okay, that's okay. I'm just going to check it very carefully first with this little pen light. I'm going to put that right next to your eye right there, okay? And I'm going to ask you, can you cover one of your eyes with your hands like that? Good, I'll just try to cover it a little bit too. All I want you to let me know is if you see the light. Okay, do you see the light there? Good, and what about now? Good, what about now? Yes, you do, and what about now? No. Okay, now I'm going to ask you, I want you to follow the light with your eyes wherever you see it, okay? Good, can you see the light? Good, just follow it with your eyes down and all the way up. Good, and all the way down and all the way up and all the way down again. Good. And now I want you to just release that hand from your eye. I'm going to ask you to put your other hand on your other eye like that. Good, I'm going to just cover it as well just to double check. Same exact questions as last time. Okay, and do you see the light now, yes or no? Good, and what about now, yes or no? No, okay, what about now, yes or no? You see the light now, and what about now, yes or no? Good. Now simply follow the light. It's going to just move from up to down. Good, and up to down. Good. 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 Good, okay. Now tell me, are your eyes feeling okay after I've just put the light in front of them? Okay, I'm just going to carefully cover your eyes, and I want you just to cover your eyes and just partially close them like this. I'm going to scan the light over your eyes and look for any issues with your pupils, okay? Good, I'm going to get really up close for this, and you have gorgeous eyes, by the way. They're very stunning. So I'm just going to carefully scan right here, okay? And scanning, scanning, okay, scanning, and scanning, okay, scanning, and scanning. Okay, I'm going to get another device for this next part. I'm going to get even closer, and I'm actually going to scan one more time. So just close your eyes partially, okay? And I'm just going to scan, and scan, scan, and scan. Okay, and then keep your eyes looking at me. Good. Can you look over there for me where I'm snapping? What about here? What about above? And what about below? Okay, very good. Let's test your peripheral vision now. So we always do a head-to-toe exam. I'm checking your eyes. We're going to check your head, shoulders, knees, and then toes till the very end, okay? So checking your eyes, let me know when you no longer see my hands. Just stare at me when you no longer see it in your peripheral vision, okay? Good, and what about now? Good, what about now? Good, and now? And now. Good, okay. Now I'm going to ask you, opposite, let me know when you see my hands appear in front of your peripheral vision. Just keep looking at me, okay, love? Good job, okay? Good, what about now? Now. Now. Good, now. Now. And what about now? Okay, now I'm going to give you a little bit of a test with the pen light. I'm just testing distances and peripheral visions. I'm going to shine a light really close to your eyes, but I'm going to have you either look at the light or my hands that move around, okay? So just shining the light right there in front of you. Okay, I'm going to have you first. Can you look at my fingers right there? Good, and look at the light. Can you look at my fingers? Look at the light. Look at my fingers. Look at the light. Look at my fingers. Look back at the light. Keep looking at the light. Keep looking at the light. Look back at my fingers. Good, and look at the light. And look back at my fingers. And look back at my fingers. Very good. I'm going to switch to this side just carefully a little bit. Okay, can you see my fingers right there? Good, and can you look at the light? Can you see my fingers? And can you look at the light? Can you look at the fingers? Look at the light. Okay, look at the fingers. Look at the light. Look at my fingers. And look at the light. Very good. What that tested was just peripheral vision and peripheral optic nerve vision with a little bit of cranial nerve test. I always test that, okay? Now I'm going to just carefully test your scalp. Let me know if you feel any sensitivity on your scalp. I'm just going to quickly examine it to see if there's any rashes or skin problems, okay? Good. So I'm just going to carefully get right up there onto the side of your scalp. Okay. Okay, any pain or sensitivity, darling? Okay. And do you have any sensitivity with your ears at all? Because we're going to check those next. Okay. Okay, let's test your ears next. I'm going to quickly take a look. And if I see any wax, I'm going to remove it, okay? So let's carefully test inside your ears. You're just going to hear a little bit of noise here, okay? Okay, it looks like we do have some wax right there. And I'm just going to remove that a little bit right there. We're just going to remove that with this little Q-tip, okay? Just going to remove that a little bit. Good. Good. Great. Good. Good. And checking the other side, we removed quite a lot of wax. Okay, let's take a look first. It looks like this one also has some wax buildup. Okay, I'm just going to carefully just wipe that away, okay? I'm just going to clean that a little bit. Good. Very good. That's actually superb. It's so clean now. Good. Okay, we're going to remove that. Now that I took a look inside your ears, they're super clean. I'm going to whisper something in each of your ears, and I want you to tell me what I'm whispering back to you, okay? Good. So I'm going to get really close up to your ears. I'm going to whisper something, okay? Telescope. 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 And what was the word? It was telescope. Good job. I'm going to do the other ear now. Okay. Coconut. 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 And what was the word? The word was coconut. Good. Coconut. 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 Rain. Very good. Okay, now what I'm going to carefully do is I'm just going to move all the way down to your nose, okay? I'm going to just take a look right into your nose. Let's see. Just breathe in for me. Breathe out. Other nose, breathe in. Breathe out. Good, clean. Now let's check your mouth. And I'm just going to ask you to say, ah, very good. We're going to see if you have any teeth problems. Have your teeth been, love? Good, let's see. Okay, looks like your mouth is doing good. Good. And can you just say, ah, and just stick your tongue out? Good. I'm going to see. Good. Any problems with your tonsils or your lymph nodes at all? Good, your mouth seems good. I'm going to just carefully fill your lymph nodes right there. Okay, and then can you just tell me if there's any pain or pressure when I do that next to your lymph nodes? How are you feeling, sweetness? Good. Okay, now I'm going to move all the way down to your shoulders. I'm just going to pinch them. Let me know if you feel any sensitivity there. Feeling good? Okay, and then I'm going to move all the way down to your arms. Do you feel any sensitivity there, or do you have any pain? Nope. Okay, what about this side? Okay, nope. And then can you just bend your knees for me? Good. Any pain when I put pressure on your knees? Okay, what about this side? Okay, and what about all the way to your toes? I'm going to put a little bit of pressure on your feet. Any pain or sensitivity there, or any weakness? Let me know. Okay, up to the bottom, let me know. Okay, now give me your hands. I'm going to ask you just to carefully give me your hands there. Okay, then what I'm going to do now is I'm just going to feel them. Any pain or sensitivity? Good, and what about now? Okay, good. Now I'm just going to carefully test all of your muscularity. Can you just shake my hand for me? Good, on the other hand, shake the hand for me. Good, and now I'm going to put a little bit of pressure on your shoulders. I want you to resist, okay? So resist, good, resist, good, resist, good. Now, can you puff up your cheeks like a little puffer fish? And what I'm going to do is I'm actually going to try to push the air out of your mouth. I want you to try to resist me doing that, okay? Good, so just do that. Resist, 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 resist. Good, you can relax now. Now I want you to close your eyes as tight as possible, and I'm going to try to open your eyes. Just resist me doing that, okay, love? Okay, so resist, 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 resist. Very good. Okay, and then one last thing. I always have to do this. I'm going to quickly scan your skin for any signs of irritation or rash, okay? So I'm just going to ask you if you want to close your eyes. You absolutely can for this, but I'm just going to first check your scalp. Okay, let's actually see there. Nothing there. Okay, let me check your face. Let's check your face for any signs of rashes or sensitivities. Good. I'm actually seeing nothing, which is fabulous. Okay, let's see your arms. Good. And your shoulder blades. Good. No signs of rash there on your arm. Good. Okay, and then maybe a little bit on your leg. Let's see. Okay, let's see there. Signs of lightness or signs of rash or irritation. Did you notice any? Okay, good. And then all the way down to the feet. Good. So it actually looks like you're absolutely stunning and healthy today. Next time, please come a little bit earlier. If you are feeling extra tired, please tell that to the doctor, and I know the doctor will absolutely give you a solution to solve your sleep and remedy all the tiredness that you have. Okay, love? Okay, so next time, come a little bit earlier. I have a very lovely date with a sandwich, and I will send you right to the doctor. Have a good one, love. Ciao.